Let's talk about COVID and HIV awareness, prevention, being able to get any awareness messages out with the umbrella of COVID. And how hard has COVID made your job this period?
One thing I think we definitely need to cover is that the unfortunate effect, and this is what I think we all know, is that people have not been accessing healthcare in 2020 the way they were pre-COVID. And so what we've seen in certain jurisdictions and what we're seeing increasingly in the data is that there might be as much of a 45% decrease in the amount of testing that was done in 2020 versus the year before. And what we're starting to see now, and we're getting reports of, is that people are seeing increases in the number of AIDS cases that they've seen previously now. And I want to make that distinction. So people are showing up with an AIDS diagnosis, which means you have more advanced disease and you have opportunistic infections, when if you catch it earlier, you would come in with an HIV diagnosis. So I think that's one critical thing in terms of the lens of COVID and HIV, is that it has had an impact and we need to double down. And I think the other thing is the existing STD, other STDs are at an all-time high in the country. And that's something that goes hand in hand. I remember when physicians like Dr. Smith used to say, that was a lead indicator at the height of the epidemic. If you came in with gonorrhea or syphilis, you were likely to, show up later with HIV. So I think those are a couple of things that we need to really turn up the volume on.
Yeah, my entire job has changed. My agency is a direct social service provider as its primary life, and we just celebrated our 35th anniversary as an organization. And last year in March, I had to make one of the hardest decisions of my career, which was to close down our on-site services for the first time in the existence of our organization for a community of people that truly need us every day. For most people who access traditional aid service organizations, we are not only the place that they come for access to resources, but we sometimes are their primary network and system of support. We are the place that they access a phone, the internet, the supplies that they need to shelter harsh weather wherever they may live. And we had to find a way to balance the health and safety of our team and the community. And it was a really difficult time. We had to figure out as organizations how to transition to still provide services through kind of a virtual space like this, but recognizing that meant that we would lose people in the cracks, and that the people we were losing in the cracks were in fact the people who needed us the most in real time, but certainly during COVID. The shift, I think, for us then became not new issues that arose during COVID, but existing issues in our community that only were escalated by a result of COVID. So things like addressing food insecurity. We've had to ramp up a nutritional food program for people living with HIV in ways that we had never experienced before. People weren't able or were afraid to leave their homes to go and get food, or couldn't get to the local food shelter during the limited hours that they were open. So we had to create a meal delivery service. The economic impact on communities who already had limited income or were doing frontline jobs that were unable to continue to do those increased our housing waiting list. It increased the need for emergency medical motel vouchers to get people living with HIV off the street and into stable housing. And our request for emergency rental assistance, just monthly rent or utilities, skyrocketed throughout the first year of the pandemic, all of which had Band-Aids to fix them, right? Like you get a one-time injection of federal funds, but then in last spring, but then by the fall, we were asking people to return to their life on the street because there was no longer funding to sustain their temporary housing options. So it's created a massive issue in a place where there already was a lot of disparity, and a place where there was already a lot of challenge to get people stable and consistent in their care. The other thing that I think is really important here is that, we're in a time now as we head towards the 40th anniversary of the first cases of HIV in our country. And the people who survived those 40 years, the long-term survivors, whether they were living with HIV this entire time, or they're a survivor because they lost a generation of their friends and family, this is a second wave of a pandemic for them in their lives. This is a whole, this is a whole nother time of uncertainty, a time of loss, and it's created a new set of fear and anxiety, isolation, and really triggering mental health issues as they think about a time that was one they barely escaped. And now here we are again, where they're being forced back into that isolation and unknown.
I think Tyler's been a fly on my wall because I had a list of stories that I'd like to see come out about HIV, come out of this COVID time. And he just touched on every last one of them. Just check. The mental health issues that I'm not seeing anything about. I also would like to see stories about the effectiveness of the vaccines on immunocompromised people. I'm not seeing enough information. I know you should get the shot regardless, but is the effectiveness less? I'm not seeing that. I'd like to see stories about that.
Dr. Smith, what do you say about that?
Kendra's exactly right. I think we need to see some data about, immunocompromised individuals and, how effective is the vaccine. If I were to venture a guess, my expectation is that the overwhelming majority of individuals who are living with HIV will have excellent responses to the COVID vaccine, like they do to most vaccines that they receive. And so, you exactly right, Kendra, folks should get it because their risk is super high. We've seen some stories, some reports in, at research conferences about question of whether or not people who are living with HIV have worse outcomes as a result of COVID. And it's all over the place. In many cases, individuals living with HIV that are on treatment have really strong immune systems. And so they are just like anyone who's not living with HIV. But then individuals who have more vulnerable immune systems are going to be more vulnerable to, bad outcomes from COVID. And then, one of the other impacts that, we've talked about a little bit, but I just really want to emphasize what COVID did was actually keep people away from treatment. And so they didn't seek care for things that were going on with them because they feared going to the emergency room or the clinic that they typically went to was either closed or only seeing folks with COVID, or you just didn't want to go because you were so fearful of the exposures that you might get there. And so people, basically were avoiding seeking care. Now you can imagine if you have a benign illness, that's no big deal. But if you have something where, it's progressively worsening if you delay care, then that's a horrible thing.